topic is incised wound. Hello, dear students. We'll have a discussion about a clinical case, rather trauma. Let's see what type of wound it is. See that in the leg lower part, just above the heel, near the Achilles tendon. It's a typical of incised wound. It's a clean, tidy and tidy wound classification is there. Simple, clean cut wound with linear cut edges. It is treated. It's a incised wound actually. Incised wound. You know that what is the meaning of wound? Wound is a disruption of tissue structurally and or functionally. Maybe any tissue, skin, soft tissue, bone, or organs, anything, luminal structure, anything. Whereas ulcer is only epithelium with molecular death. So ulcer is one of the type of wound. Wound is a very gross defined entity. That's the difference. You should know the difference. So it is this incised wound treated with the primary suturing. You know that primary suturing, delayed primary, if there is edema, ragged edges, and secondary suturing later once everything is after infection after 10 days or 2 weeks. So primary, delayed primary, secondary suturing, meaning you should know. Here this is treated with the primary suturing under local anesthesia. Remember all these things: rank and Wakefield classification, tidy, untidy, types of wounds, incised, lacerated wound, contusion, hematoma, abrasion, puncture wound, penetrating wound, crush injury, gunshot injuries, blunt injuries, closed wounds. Wound may be open, closed, simple, complex, or combined. That is a bone, soft tissues, vessels are involved. They're complex. Wound may be acute, progress through normal phases of healing, usually in 4 weeks. Heals 4 weeks, whereas chronic healing does not occur in expected period of time due to typical or atypical causes, usually after 4 weeks. But exact meaning is does not occur in expected time of healing. That is the typical. So classification surgical wounds by Beard, you know, clean, contaminated, dirty wound. Different examples are there. Contaminated, clean wound. Appendicectomy is open vasectomy, clean, contaminated. Peritonitis is the contaminated wound. Dirty wound is a lot of pus, frank pus. Sepsis is there. That is dirty wound. That is the surgical wound classification by BR. It's very, very important. MCQ question will be asked about different types examples. So you know the examples of each, so that MCQ can answer. So rank and Wakefield classification. So these are different types of classifications often asked as in MCQs, which you have to remember. So answer the MCQ. Appendicectomy wound is clean wound, clean contaminated wound, dirty wound. Give the answer in the comment box. I will give the answer later. Exudative phase of wound healing begins immediately and lasts for 72 hours. Begins after 72 hours and lasts for 4 to 6 weeks. Begins after 6 weeks and lasts for many months. Begins immediately and lasts for 10 days. Find out the right answer, put it in the comment box. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient, swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in the table format is given, and briefly investigations. Of course, treatment is not a topic will be covered in a clinical method examination. Remember, and many photos of most of the conditions with the illustrations. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn. Very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. It covers theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations and used worldwide also, actually including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB's operative surgery atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything with around more than 10,000 illustrations and photos. It gives very good principles and technical, step by technical aspect. Very, very useful for postgraduates. Not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book and memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step by step with illustrations. And my SRB is Atlas of Tissue Approach, small book, Atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very, very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. Your daily lectures are there, live sessions are there. My DigiNower lectures through JP Publishers, around 220-hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.